So based on the numbers and based on what's happening, we are definitely in the start of another wave going on. Alabama's numbers are starting to climb. We're just below a 10% positivity rate, which is up a couple percent from just a few weeks ago. And nationally, obviously, that's happening, including in previous hotspots like New York and Massachusetts and Connecticut and other parts of the country. And then finally, of course, internationally, you see what's happening in Germany, in France, in England, Ireland, even Italy, all the different countries. A number of them are going into restrictions and lockdowns. So it's happening. So what I've learned so far from this virus is that it has no political preference. Doesn't matter whether you're a Republican or a Democrat or whether you just don't vote at all it matters is whether or not you've been infected or not infected. So regardless of the outcome of elections, okay, um, the only things that have been shown to work are wearing masks, physically distancing, sanitizing your hands, and limiting your group size. So election results, be whatever it is, I think you need to understand that the virus hasn't gone anywhere. It's just as contagious and it's going to spread. So those students and actually members of the Auburn community, faculty, staff, students, and even people in the surrounding area who've really done their best to prevent the spread of the virus by doing all the things that were asked of them, irrespective of any ordinances. I say to you, thank you. Thank you from the bottom of my heart. I speak also on behalf of other healthcare clinicians who are caring for people in intensive care units and other places who are putting their health and safety on the risk every day. And it's all the people that are doing what they should be doing to prevent the number of cases, a number of people getting COVID, and possibly the number of people needing to be hospitalized, or risking that Auburn University would have been required to go on all online. I say thank you for your efforts. It's much appreciated. It's going to be soon that in a matter of a couple weeks, your sons and daughters are going home, or if you're the student, you're going home. This is the time to start hunkering down at least 14 days out prior to your departure if you have not had this virus. That's important because when you get home, there's always the risk that you're going to bring it home. And so you need almost to create your own little 14-day restricted or to some degree your self-quarantine prior to coming. Those of you that are going to have vulnerable or high-risk people there, you may want to take some extra steps, including testing a day or two before you go home. You want to pre-schedule that as best as possible in an effort to, again, decrease the risk of giving it to someone who's vulnerable. So start thinking now, start acting now, be responsible. The virus has clearly shown us from the very beginning that cooler temperatures, people more indoors, gathered in groups, is an ideal environment for the virus to spread. Remember, this virus started over the winter time, and here we are, 10, 11 months heading into it, and we are going to see more spread related because of the congregations of people and more indoor activities. So it will continue to spread, and we have to take that into account as we go through our daily lives and activities. Clearly, with COVID fatigue and the challenges of this being more of a marathon than a sprint, we're seeing people who have developed mental health issues. Add to that the shortening days and the sun going down earlier, and you have seasonal affective disorder also kicking in. We're in for, again, a period here where people need to pay an incredible amount of attention to your mental health. and the importance of recognizing your symptoms and getting the necessary help. And the necessary help could be start from everything from, light therapy to meaning using lights, or connectiveness, talking to people, reaching out, interacting, checking on others, doing all of those things. I think we're in that period, and we need to work together as a unit, because it's not an individual process that's going to make someone better. It's going to take everyone doing their part. So with the colder weather, we're getting into obviously cold and flu season, none of which has gone away. COVID just came into the picture. Obviously, everyone with cold and flu symptoms may not have COVID, but we have to consider it. So what we've done is, over the last week, we've pivoted to where we are offering in-person visits on the second floor of the clinic, so separate from the rest of the clinic population and the other patients. So we're focusing all our respiratory complaint type effort to be seen by clinicians in person with the appropriate PPE. This way, if someone has, strep throat, mono, the cold, the flu, or anything, we will be able to delineate that outside of just doing a COVID test. So I encourage you, if that's the case, please call the clinic or use the patient portal and make an appointment. When a person gets a flu shot, it takes about 10 to 14 days for it to be effective. For those of you that are going home, or for those of you that are having people come to your home, you're in the last real week of when it's the best time to get the flu shot and it be effective by the time you get home for Thanksgiving. So this is your week. There are flu shots available at the clinic. You don't need an appointment. But even if you don't get it at the clinic, that's fine. If you're going to get it, please get it. It's available in pharmacies, grocery stores all over. But now is your last chance. Past this next week, then it's not going to be as protective for you for the Thanksgiving holiday. So I encourage you to make the effort and get a flu shot.